Hello, this is Module 4, Evidence-Based Practice for Nephrology Nursing. Dr. Jamie Brown and myself prepared this module. This module is designed to provide an overview of evidence-based practice, especially as it relates to nephrology nursing. This module is a component of a 5-part research series developed by the 2020 ANA Research Committee. The module provides knowledge and skills to integrate the best available evidence to guide nephrology nursing in informing care practices and improving patient outcomes. More information can be found at the following website. The objectives of this module are to define evidence-based practice, discuss the need for evidence-based practice, describe reasons why evidence-based practice is needed in the field of nephrology, describe steps of evidence-based practice, the process, and identify best practices based on the best available evidence. We will provide an overview of the role of nephrology nursing in evidence-based practice, how to formulate your clinical question and the importance of the clinical question, a basic review of how to start a systematic search for the evidence, critical appraisal of the evidence, and integration of evidence and clinical expertise and evaluation of outcomes. The days of practicing where we just said, my preceptor did this way, so that's why we do it. We always do it this way are over. Today, nurses are more involved in improvement projects and practice change projects. In the Future of Nursing report, it emphasized the importance role of nursing and in the interprofessional teams that focus on improving healthcare delivery systems and patient care through evidence-based practice. So you might ask, what is evidence-based practice? Well, evidence-based practice is the conscientious and judicious use of current best evidence in conjunction with clinical expertise and patient values to guide healthcare decisions. Evidence-based practice is a problem-solving approach to clinical decision-making that integrates the best available evidence and clinical expertise along with patient preferences and values. Evidence-based practice follows a systematic process and approach. With evidence-based practice, there's the use of research and other evidence, such as guidelines, along with the clinical expertise to make the clinical decisions. Evidence-based practice is crucial in the delivery of safe, quality care in nursing. In addition, gaining skills and knowledge of the evidence-based practice allows nurses to be members of the healthcare team as we face and be key champions in healthcare reform. As we face many changes in healthcare, it is very critical that nephrology nurses are involved in evidence-based practice. The role of the nurse and nephrology nurse in evidence-based practice is to provide high quality and most sufficient nursing care possible, to advance quality of care provided by nurses. It results in better patient outcomes. It also contributes to the science of nursing. And in evidence-based practice, we're not doing a research study, but when nurses do research studies, that evidence is translated into practice. And this is where it's really important when we look at our practice to say, what is the best evidence and how do we contribute to this, either by conducting research or by conducting a clinical project, such as a quality improvement project or a program evaluation to determine what are the best practices. It also keeps us healthcare practices current and relevant. Why is it important in the field of nursing? You might ask that question. Well, as nurses strive to be leaders and active participants in healthcare redesign, it is essential that they possess the requisite knowledge and skills to engage in evidence-based practice. Evidence-based practice has become part of the professional practice guidelines for nurses and an expectation for the healthcare system. It is a way to address a clinical problem, improve quality of care By taking that best available evidence, such as we discussed previously, research guidelines into practice as you engage in shared decision-making with your patient and family members as appropriate. Evidence-based practice is also important because it can help reduce hospital length of stay, reduce the risk of complications when the patient's goes to hospital or within your dialysis center, or for patients that we're providing care for at a CKD clinic. There have been studies that looked at mortality and morbidity and saw a reduction as we engage in evidence-based practice. And most importantly, it increases the patient's satisfaction. The quality of the care, the experience of the care is much improved with evidence-based practice. The movement toward evidence-based practice has been well over a decade. We know it is critical to leave our old pattern as discussed before, and we can't practice anymore from did this way, we always do it this way. I can remember years ago being in a dialysis center as a nurse and asking the question, why are we doing this way? And one center said, well, because Mary says we have to do it this way. And Mary was the manager of the center. And I thought, well, where does Mary get the evidence to support this? This is no longer acceptable. We have to know what the evidence is and be that advocate to institute that evidence by taking that best available evidence, as was said before, and considering patient family values and preferences for care, as well along with our expertise as nephrology nurses. The goal of evidence-based practice in nursing is to assist nephrology nurses in delivering the highest quality care to those with chronic and acute kidney conditions. Even though evidence-based practice is the movement is strong and it is something we do as nurses and we're engaging in this across many healthcare settings, there are many barriers, and some of these barriers to evidence-based practice have been identified by Melnick and Fineout-Overholt. Some of the barriers are lack of knowledge, skills, and clinical educational programs. I know that in undergraduate programs, BSN programs, they are now instituting evidence-based practice and students are learning how to engage. But many of us have been in practice for a long time and may not have gotten those educational programs, or some programs may not be doing these type of educational programs. So that is a big barrier. Lack of time, resources, and administrative support. I instituted a evidence-based practice program at the hospital that I had worked. And one of the biggest barriers was time for the nurses. They had to leave their patients often and come to a meeting. And then they said, sometimes they would tell me that when they went back, things weren't taken care of because the other nurse was so busy. So time is really important, and having those resources and of course, administrative support is essential. It can be because you have an overwhelming patient load and it's very hard to even consider anything other than delivering the care to that patient. There are misperceptions and negative attitudes towards evidence-based practice. Oh, it's too much work. What's the value of it? There is a culture steeped in tradition. As we stated before, we always have done it this way. There's a lack of belief that evidence-based practice will make a difference. And it's often teaching people about evidence-based practice might be too much information at one time. So it's steps along the way, and some mentoring is very important. And there may be that patient and or family insistence on a particular treatment. So you may have a family member who said, I want this, my loved one to have this treatment, or in the dialysis center, I want my loved one to have this diet, or then you have to, educating these family members, it can help you provide help them to understand why you need to do this and how this can be the best for the patient. And so this is an opportunity to engage in education with family members. Some facilitators of evidence-based practice is having a change advocate, someone who embraces the importance of evidence-based practice, aligning key stakeholders, taking time to critically appraise the evidence and implementation of any project that you did, quality improvement, program evaluation, Having proper tools, so having the ability to collect data, having the education for those who don't know what evidence-based practice is, evidence-based practice policy and procedures within your institution or your facility, addressing misconceptions about evidence-based practice. It's very important to provide education and educate others about evidence-based practice. There are many models of evidence-based practice. The one that we're going to talk about today and follow is Melnick and Fineout Overholt. But if you look into textbooks, there's many models. Johns Hopkins has a great model, and they have many tools. They have a book you can purchase, and they have tools that you can use that will help guide the evidence-based practice project. According to Melnick and Fineout Overholt, the first step is spirit of inquiry and a culture of evidence-based practice, asking the burning clinical question, search and collect the most relevant best evidence, critically appraising the evidence, integrate the best evidence with one's clinical experience and patient family preferences and values in making practice decision or change, evaluate outcomes of practice decision or change based on the evidence, and disseminate the outcomes of the evidence-based practice decision or practice change. And we're going to talk about some of these steps in the next several slides. So finding the best available evidence by asking the burning clinical question. There is a background question that you ask, and the background question first is when you start going into literature just to see if this is a problem. But the foreground question is where you're going to go in and look in the evidence to see what could be possibly an intervention that would, what intervention may address the clinical problem. So the first thing is to have that spirit of inquiry. When you're in practice, you may have questions and say, oh, I wonder why we're doing it this way. What evidence supports that we're doing this way? You should always consider when you're doing something, an intervention in practice, why are we doing this? What evidence supports that this is the best intervention? But you also need a culture that supports evidence-based practice. Very important that you have buy-in from your administrative staff. So asking that clinical question helps identify components of the clinical problem and supports that literature review. Specific questions when answered provide evidence that supports the clinical decision-making. The components of the clinical question are written in a PCOT format, and P is population, I is interest or intervention, C is comparison intervention or issue of interest, O is outcome, and time, T is time if it's appropriate. You don't always have to have time if it's not appropriate. So these are the types of questions you could ask. The most common type of question is intervention question, and that's what will be presented here. But you could also ask etiology question, diagnosis or diagnostic tests, prognosis, predictor, meaning, the understanding the meaning of experience of a particular person. But as I stated before, the most commonly used is the intervention question. So for example, this is an intervention question. In older adults with anxiety receiving in-center hemodialysis, that's the P, the population, how does music therapy during their treatment 3 times a week, that's the intervention, compared to hand massage, that's the comparison, affect anxiety level over 3 months? That's the outcome and time. So if you're talking about anxiety level, you have to be able to measure anxiety, and we'll talk more about that in future slides. The first thing you have to do is do a systematic search for the evidence. It's very important. This is a very important part of evidence-based practice. With the use of a PCOT format, clinicians can systematically search the literature through the use of numerous databases to find applicable quality studies to help determine the best evidence to achieve the desired outcomes when you're considering a practice change or when we're engaged in shared decision making with our patients and families. Systematic review is an approach to searching the evidence and will depend on the question being asked and the purpose of the search. It is important to identify best evidence through, and once you find the literature, you want to be able to find that evidence that will provide a complete summary of the current, what's relevant to the clinical question. And it is important to identify best evidence that, and then critique that evidence for quality, strength of the evidence. For example, the highest level of evidence for evidence-based practice is meta-analysis, and then followed by randomized controlled trial. But all evidence is actually very relevant. Qualitative research is important, and it can inform a practice change, and it can be an important part of evidence-based practice, even though the strength of qualitative research is not as high as randomized controlled trial or meta-analysis. Steps taken to conduct an organized search to find and collect all the relevant studies are, and you're not going to get all the studies, but you get as many as you can, is really you determine the review criteria to select only those research studies that will answer the question. And so this is through your search terms. You want to have searchable databases and identify the right databases. You understand the setup of the database to specify the search. Use the database language to search words, symbols, combination of words to obtain the required information. In addition, the systematic process should be discussed in your project and the steps of your project. It's an important part of planning your project, which we'll talk about in the next few slides. You will determine the best available evidence to design an intervention that answers that clinical question. And it's important to look at peer-reviewed journals, and that evidence, has been reviewed by your peers, by someone who's an expert in the area. And when you look at clinical guidelines, look at where that evidence comes from. Some of that evidence is not, it's an opinion because we don't have, it's coming from an expert opinion because we don't have research because of many barriers to research with our population. But look at that and make the decision. Don't just take the guidelines and say, well, these are the guidelines, but where did that evidence come from to inform those guidelines? Very important. It doesn't mean you don't use that information, you do, but you want to think about the strength and the relevance to what you're doing. Here are some of the databases. You can also find these in Chapter 2 of the 7th edition of the core curriculum for nephrology nursing. Some other resources to support evidence-based practice are PubMed database, textbooks, government agencies and professional organization, peer-reviewed journals. So once you've identified the relevant literature evidence, you want to conduct a critical appraisal of the evidence. What is a critical appraisal of the evidence? It is the assessment of research studies to identify the best evidence to inform clinical practice change or practice decision. It is the heart of the evidence-based practice, and it involves 4 phases: rapid critical appraisal, evaluation, synthesis, and recommendations. It determines the worth of the study in relation to clinical practice. You want to look for validity. Does this study demonstrate validity? How accurately does it measure what it's intended to measure when you look at the measurement tools? Or you look at how valid is this study? Was it conducted with rigor? You want to look at reliability of the research. Similar outcomes can be achieved when the care techniques of the study are replicated. So can you determine if the results are reliable by assessing the size, the number of participants, and the strength of the effect, differences between the 2 groups or groups that they use? Applicability of the research conducted in a similar sample for patients to whom the findings will be applied. Are the results applicable to current clinical issues or questions, or do they facilitate patient care? So when we're doing a critical appraisal, if you haven't done it, I recommend that you have a mentor to work with you, because you want to make sure that you're looking like I said, the reliability, the validity, how does it apply to the question that you ask, a clinical question, and how can it help inform a practice change? Many of the models in the book, like Melnick and Find Out Overhauled, have a book, and they have the steps of how to do a critical appraisal. You can find textbooks now on evidence-based practice to help inform how to do these steps. University of Iowa actually has a model, and I've used their tools to do the critical appraisal. They have tools for you to use. You have to purchase it, but it's not for a nominal fee, but it's another option. So looking to see which model can help you in that you think fits best with your institution or your facility, and looking at that model. And each model will have some information on how to do the critical appraisal. We'll have information on how to do the critical appraisal, how to do the steps in the evidence-based practice process. So once we've gotten that evidence, and we know we've got the best available evidence, we can decide to do a clinical project, as I said before, or a program evaluation. And you can do this through quality improvement. So you want evidence to support an intervention? If there's no evidence to support this, then you would need to do research. And this is generation of new evidence. And this would take someone who has had education and has the knowledge and skills how to conduct a research study. And so you would need a mentor if you have not done this before, because you want to make sure that you're following the proper steps of a research study. So if there's not enough evidence, then we need to consider research and go back to the literature and find that evidence. Once you find the evidence that can support an intervention, you can do a quality improvement project. Program evaluation is of a program that's already in place that you have. I had one of my DMP students who did her project looking at a CKD MBD program and what they did in the dialysis center. She looked at what were their goals and had they been achieving their goals, and if they had patients who were outliers, patients who did not meet the goal of phosphorus, PTH, and calcium, then what were they doing? So she looked at if they were meeting their goals, and if they didn't, what were the steps that they did in order to achieve their goals? And she gave them recommendations of the strengths of the program that they had, as well as where there may be needs for change and things to address. So when we're doing clinical problem, we have to identify the clinical problem, form a team, select an evidence-based framework or model, ask the clinical question, search for the best available evidence, critique the evidence, develop an intervention to address the clinical problem, and evaluation of outcomes or process indicators. So when you're forming a team, it's important to consider an interprofessional team. So who are relevant in whatever your project you're considering? So if you're looking at medication or ability to take medication, you might want to include a pharmacist. If you're looking at depression, anxiety, you want to include the social worker. If you're looking at nutrition or CKD, MBD, definitely the dietitian would be involved. So who should be your team players? Who should be the people that are members of the team? Who will be the project team leader? You want to make sure you have key stakeholders, people who are actively involved in the project, who have an interest in the outcomes. So you may consider, if you're doing something with medication, consider nurses in the unit, nurse practitioner, pharmacist. You're planning with the team. This planning part of this project is essential, is very important, because you want to plan for how you're going to do this, how you're going to evaluate, and what are next steps. So it's important to have someone who has evidence-based knowledge and the skills. If none are available in your institution, find a mentor who can assist. You want to have, you really want to be successful in this. So definitely finding a mentor if you have never done this before is important. Establish a team that can work together. You don't want somebody in the team who's overpowering and they know everything. And you want people that are going to be collaborative. And how do we best address this? Taking these ideas of what's the best intervention? Establish a realistic timeline and ways to monitor achieving goals. And if you're not able to achieve these goals, how do you reevaluate? How do you plan? How do you reevaluate and do another project? Plan for review and outcomes and next steps. When we're talking about outcome measures, they are determining how change will affect patient-related outcomes or how effective the clinical decision was in the practice setting. How do you know the intervention did what you said you thought it would do? So you have to have a way to measure this. And so what you want to look at is, their post data. So before the intervention, after. That can be because, let's say you're testing knowledge. So you're looking at knowledge, or we said in the example, I gave anxiety. If you're looking at anxiety, then you'd want to have a way to measure anxiety before you did the intervention and then measure anxiety after you did the intervention. So you have to have an instrument, a valid and reliable tool to measure this. If you're doing knowledge and you're saying, I'm going to improve knowledge, or I'm going to see how my intervention affects, we never say improve, we say how it affects. So how my intervention affects knowledge, you would have a knowledge test. And that's something you can design yourself because this isn't a research study. So you could say, if I'm going to pre-test them on knowledge, I'm doing educational intervention, and then I'm going to do a post-test on knowledge. Let's say you're doing something on falls and you're looking at falls, you could look at falls. You can see how many 3-month data before on falls in the population you're looking at, and then do an intervention and what is the falls 3 months after the intervention. So you can compare with prior data that you have if you have access to that data. If not, then you can do a pre-post test to evaluate your intervention. Let's say the problem, for example, is high catheter infection rates and infection disease prevention intervention was put in place. Your question may be, in adults receiving in-center hemodialysis, how does an infection prevention protocol affect infection rates over a 3-month period of time? So you may have that prior infection rate data compared to the data at 3 months. So this gives you, that way you already have that data. Now you can compare it. You don't have to have a pre-post because this wouldn't even be relevant to have a pre-post test. It is important to evaluate the data that was collected, but it's also important to determine if the processes put in place were done. So when planning for a project, you need to consider what the evaluation process will be. So if you're putting a program in place, you want to make sure that people are following through with that program. And so if you can't be there all the time, you want to have champions that will be there, that will support you and support that project. And be able to say, yes, we're following through on that. So for example, if we're looking at falls and we're doing one of our program, what we've implemented is a fall prevention program. So that part of that is evaluation of functional status and following up and asking the question, have you fallen at home, or doing a fall assessment. So you want to make sure that process is in place, because if if people aren't doing the steps in the process, then how do you know your outcomes are reliable? You wouldn't know. So you want to make sure that things are followed through. Sometimes when you implement a program, you may do just a process evaluation to make sure the process is in place and then measure the outcomes. Just depends on what you're doing. You want to have plan when you're planning, have key time frame where key data collection points, if that's what. So you want to be able to, or key times when you're looking to see, are things being done? So you want to have those monitoring points where you say, okay, in a month, I'm going to evaluate this. In 3 months, I'm going to do this. So if you're doing over 3 months, you may not wait for 3 months to collect the data. Every month you may collect the data. It depends on what you're doing. If you're doing an assessment such as the anxiety and you're instrumenting, you're evaluating anxiety through a tool, measurement tool, then you would look at that at the beginning and then 3 months, and because you wouldn't want to put a burden on the patient. But if you're doing something like infection rates, you may look every month at your infection rate and see if there's any change. Because if you see, let's say you're doing an infection rate over 6 months, you wouldn't want to wait to 6 months to see if anything has changed. Because if you're not seeing the positive effect you were hoping to get, you may want to sit with your team and reevaluate and determine that you may need to change some protocol in that infection infection protocol. Excuse me. You may need to terminate the intervention because it was not effective. And when you're finished with the project, you want to definitely evaluate and see if this is something that you want to continue over time, that it becomes part of your policy and procedures. In addition, if you're in a hospital setting and you would do a micro system change, you would make a small change in the hospital and the unit before you instituted a change across the system, because you want to see if there are any barriers, if there's anything that facilitated it. Do you need to redesign it? In a dialysis center, you may just do it in 1 or 2 dialysis facilities, and not in, if it's an LDO, not across the corporation. So you want to think about how you make small change and evaluate, and then the next steps are to go make a bigger change and continue to evaluate. And even though you may have finished the project, you want to continue to have in your planning how you're going to monitor over time and when you would do this, when's the most appropriate time to do this. So now that we've done a project, what do we do with the findings? It's very important. We have many nephrology nurses doing some wonderful things in practice, and yet we don't know about them. It is so important to disseminate this, because someone else may have that same question and wondering what they should be doing about it. And you've already addressed it and you've gotten great outcomes. And it's so important to disseminate through poster presentations, PowerPoint presentations. So you do a podium presentation. We really need clinical evidence of effective interventions to support evidence-based practice clinical decision-making. In addition to disseminating through presentations, I strongly recommend that you consider submitting a manuscript to the Nephrology Nursing Journal. The editorial board and the journal is phenomenal. They are very supportive, and people who are wanting to submit a manuscript. And I can remember one of my colleagues was so excited because she did an evidence-based project with music therapy in the dialysis center, and she wanted to have that. I convinced her to consider writing a manuscript and submitting it for publication. I remember her, when it got published, the editor of the journal helped her with the grammar, with writing the journal. She wrote the article, and the editor helped her to prepare it for publication. And she was so excited when it was published. I remember her she was elated because this was hard work for her. She enjoyed what she did, and now it was in writing, and she could see it as a published manuscript. So please consider that. And I know that as I said before, the editorial board is very supportive, and especially new authors. So why do we want to disseminate? We want to increase the awareness and influence behavior change. It's really a great way for exchanging ideas, fostering collaboration, stimulating new ideas for research or clinical projects. It is great for academic and professional growth. If you're going back to school, it's a great way to say, have published already. If you're in academia, you have to publish, or as we say in academia, or perish. it helps to inform clinical decision making. So I want to thank you for your time. This is just a brief overview. It's very important for you to gain this knowledge and skills. If you haven't done it before, have a mentor. Many of the models have steps in how to do this, and they also have tools to use to support evidence-based practice. So thank you very much.